most people think of opioids when they think of overdose, but even now, even in the fentanyl era, polysubstance use is really the rule. So opioids are often involved, but usually there's at least one other substance involved. There are patients who we see who, not just struggle with addiction, but also with poverty and homelessness and trauma histories. And so their use of substances both perpetuates the trauma, but it also helps them cope with it, right? So then if we initiate them in treatment, they go through their day more clear-headed, and that's not always so easy to cope with. And so they may reach for other substances to help, cope with that. Polysubstance use is particularly frustrating because we have medications and treatments that work for opioid use disorder, but for some of the other substances that people use, we don't have the same effective medication treatments. We need more than one skill set. It really takes a team to kind of try to meet their needs.
When most people hear about overdose, they think of opioids, heroin, fentanyl, or prescription pain medications. But most overdose deaths also involve other substances as well. Therefore, these overdoses are actually due to polysubstance use. When it comes to overdose, polysubstance use is the rule. Someone overdosing on one substance alone is the exception. So why do people use multiple substances? People use substances to feel good, meaning to get high or feel euphoria, to feel normal, meaning to make up for the chemicals their brain is lacking due to repeated drug use, or to feel better, meaning the person is trying to relieve underlying physical or psychological pain or discomfort. Unfortunately, all drugs have side effects, undesirable aspects that come with the effect people are trying to achieve. Opioids can cause drowsiness and constipation. Stimulants like cocaine and methamphetamine can cause anxiety, irritability, and difficulty sleeping. It is normal and should be expected that people who use drugs will reach for other substances to relieve the side effects they are experiencing. Many people who binge on stimulants use sedating substances like alcohol, benzodiazepines, or opioids to come down from the stimulant high. For people who use opioids, alcohol, or benzodiazepines on a daily basis, withdrawal symptoms are key drivers of ongoing daily use of the primary substance. Opioid withdrawal symptoms include irritability, anxiety, runny nose and eyes, sweating, nausea, diarrhea, full body muscle aches. People describe withdrawing from opioids as the worst flu of their life. Seeking relief from these withdrawal symptoms is a powerful driver, stronger than any cravings for euphoria. People who use daily develop increasing tolerance to the primary substance and struggle more and more to control and tolerate withdrawal symptoms. To cope with withdrawal symptoms, people commonly take other substances that extend or mimic the effects of the primary substances. For people who use opioids, these include other sedating medications like benzodiazepines, alcohol, anticholinergics, clonidine, and gabapentin. People may also use synergistic substances to boost the euphoria or the withdrawal relief of the primary drug. People who use opioids commonly boost the effects with a benzodiazepine. People who use cocaine often drink alcohol at the same time, not only as landing gear, but also to intensify and prolong their cocaine high. The combination of opioids with other sedatives, like benzodiazepines, and the combination of cocaine and alcohol result in increased risk of toxicity, specifically increased risk of overdose. Polysubstance use is not only the rule among people who overdose, but it is very common among people in general who use substances. The most common substance that is used with other substances is nicotine. In addition to immediate health risks like overdose, people who use substances are at high risk of long-term complications from smoking, like cancer, heart disease, and stroke. People who use multiple substances are less likely to initiate and engage in treatment. Those who are able to reduce their polysubstance use are more likely to be successful in treatment. The best way to understand and help a person with polysubstance use is to ask them about their substance use. Ask why they use each substance and how their use of each substance is related. Understanding the role of polysubstance use can help guide medication and behavioral treatment. It is crucial that we try to lower barriers to treatment for this population and ensure access to harm reduction services. In summary, healthcare providers should 1. Recognize that polysubstance use is the rule rather than the exception. 2. People use multiple substances to minimize side effects and withdrawal symptoms, as well as to boost effects of primary substance. 3. Take detailed histories that include asking patients why they use each substance and how their use of each substance is related. 4. Ask about tobacco and nicotine use and recognize them as form of polysubstance use. 5. Provide low barrier and harm reduction services to engage and improve the safety of people who use multiple substances.